Imagine this. You're starting a 12-hour shift, but before you even touch a keyboard, your AI assistant has already prioritized your patients, flagged urgent alerts, and pre-filled half your documentation. This isn't the future of nursing, it's already happening. Welcome to SkillSync AI, where we explore how artificial intelligence is transforming job roles across every industry. Today, we're stepping into one of the most high-pressure, human-centered professions in the world, nursing. Nurses are the backbone of healthcare, but they're also burning out at record rates. A recent global survey found that over 70% of nurses report emotional exhaustion, and more than 50% are considering leaving the profession entirely. But amidst the chaos, something surprising is emerging. AI isn't replacing nurses, it's giving them breathing room. Let's look at the real ways artificial intelligence is helping nurses work smarter, stay safer, and reclaim time for patient care. Charting and documentation, without the keyboard. Ask any nurse what eats the most time, and they'll say documentation. Recording vital signs, incident reports, shift handovers, it adds up to hours per week, often during unpaid overtime. But tools like Suki AI, Doximity, and Nuance Dragon are changing that. These platforms use voice recognition to transcribe clinical notes in real time. Instead of typing, nurses speak naturally. The AI captures the structure, abbreviations, and medical jargon, and formats it automatically into the EMR. One pilot program in Michigan found nurses saved over 60 minutes per shift just by switching to voice-first documentation. A pediatric nurse from Seattle described it this way: "I can talk through a charting session while walking between beds. It feels like the documentation finally keeps up with my pace." Predictive risk alerts. That Actually Work AI is now analyzing real-time patient data to predict problems before they happen. At hospitals like the Cleveland Clinic, algorithms track things like rapid changes in vital lab results, nurse observation notes, and they send real-time alerts when a patient might be at risk of falls, sepsis, or cardiac issues. Instead of reactive care, nurses are empowered with early intervention tools. A 2023 study found that predictive AI reduced unplanned ICU transfers by over 25%, with nurses reporting higher confidence in decision-making. Smarter medication errors can be deadly, and nurses are often the last line of defense. Now, AI tools like MedAware and DoseCheck are cross-referencing prescriptions with real-time patient data to flag dangerous drug interactions, detect unusual dosage patterns, alert nurses before administration. In some hospitals, nurses scan the barcode on meds, and the AI immediately checks it against the patient's history. It's safer, faster, and reduces stress during peak rounds. One hospital in Sydney reduced adverse med events by over 40% after rolling out this AI system. Patient education and discharge automation teaching patients what to do after discharge is time-consuming and often inconsistent. Now, AI chatbots and personalized instruction generators like Florence are assisting nurses with tailored discharge plans, medication, reminders, diet, and mobility guidance. These instructions are delivered to patients by SMS, email, or even voice messages, reducing readmission rates and freeing nurses to handle more urgent care. Support for mental health and burnout prevention. What about the nurses themselves? Tools like Wysa and Wobot are now used in hospital systems for anonymous mental health check-ins during or after shifts. These AI-powered chatbots offer quick breathing exercises, cognitive reframing questions, emotional journaling prompts. While no substitute for therapy, they're a non-judgmental outlet. Many nurses say helps them process stress and avoid breakdowns. Real-world examples, nurses using AI today. Let's look at a quick example. In Singapore, community health nurses are using AI triage tools to optimize home visit schedules. Instead of driving randomly across suburbs, they receive optimized routes based on patient need, location, and urgency. In Toronto, AI chatbots help night shift nurses screen patient questions, before escalating to on-call physicians, reducing overnight wake-ups by over 30%. And in Brisbane, a regional hospital is training nurses to use ChatGPT to summarize shift notes, write care plan summaries, translate medical terms into plain English for families. What AI can't do yet. It's important to be real. AI isn't magic. It's a tool, not a nurse. AI doesn't replace clinical intuition, emotional judgment, physical bedside care, and while most tools are accurate, they still require human review. Ethical issues like data privacy, bias in decision models, and alert fatigue must be addressed as adoption grows. The future of nursing isn't robots, it's support. AI is helping nurses spend more time at the bedside, less time behind a keyboard, and reclaiming headspace in one of the most demanding professions on Earth. If you found this video helpful, like and share it with a nurse you know. And for daily breakdowns of how AI is transforming job roles across every industry, subscribe to SkillSync AI. Tomorrow we explore how radiologists are using AI to detect disease faster than ever. One job, one role, every day.